Hi, I'm Mike with the CaringHand Home Healthcare. CaringHand was established in May of 2008 by my wife and I with the help of our dear friend Travis Krall. In the beginning, we didn't know how to help, so we started a senior resource room. We try to make it easy for people to come in and experience what it's going to be like to go through the processes of getting their mom's or dad's help. So this is a free senior resource room, and we invite everybody in the community to come in and use this room. So at a CaringHand, we understand how challenging it can be to find free help for your moms or dads. So we are able to walk you through the Medicaid process and through the VA process to getting mom or dad help on the homemaker benefit or for respite care. Most of the time when people come in, they have a lot of questions, and I can answer those questions simply by finding out how much money mom or dad is making on their Social Security. If they're on disability, are they a veteran? Do they have long-term care insurance? Do they have a trust to put their money in? Have they set themselves up with a living will or a power of attorney? These are all the questions that we ask right off the beginning. So a CaringHand is our non-medical home care. We specialize in helping people with cooking, with cleaning, with laundry, with a bath aid. We can do transportation. So one of the big things with seniors is dehydration, so they may need to be reminded to drink water a lot. They may be losing weight, which is failure to thrive, so they may need cueing or have someone help them with a meal preparation. So we're able to help people with Parkinson's, with multiple sclerosis. We can help kids with autism and Asperger's. The neat thing about a CaringHand is that we never put a caregiver into a situation that they haven't already been in before. So I believe that proper planning will be a huge step in the success in that case. So we won't put anybody in with your mom who has dementia unless they've had dementia training or have had family experience with dementia. The same with Asperger's and autism. If you've never worked with an autistic child before and you go in and you try to do it without the proper training, you're almost always going to fail. We bring in outside agencies every month to train our caregivers. And like I said, they cannot work a shift unless they've had experience in that diagnosis. One of the things I'm most proud of at a CaringHand is that we drug test all of our employees. Everybody who comes through automatically has to do that when they go through their orientation. We make sure they have a clean driving record, they have a TB test, we do a 2-hour orientation, and we do monthly trainings that we invite everybody to go to, as well as the drug screening. One of the neat things about a CaringHand is that we always send our client care coordinators with the caregiver to the client's house and do personal introductions. We never just send the caregiver to the client's house without us being there to intercept, to introduce them. We like to go over the care plan. We like the client to understand what the caregiver is there to do, and we like the caregiver to know what they're expected to do. So if we explain all that to them and lay it out, they have a lot higher chance for success. After that is done, we always do 3 follow-up phone calls with the client and with the caregiver to see how it went. CaringHand is our non-medical home care, and that led us into several other areas. So by seeing the need for skilled nursing, we started All Care Health Solutions. By seeing the need for dementia training and those private family educations, those mini mentals and doing those one-on-ones, we started Alzheimer's Idaho. And once we found somebody who wasn't thriving in their house, who's had a lot of falls, who's not thriving at life, and we're able to put them in a facility, and then I can go back a couple months later and see how happy they are. They're surrounded by people their own age, they're playing checkers, they're having the time of their lives. That makes me feel good, and I know that they're going to be a lot happier and healthier in the long run. I'm Mike Flowers, the owner of a CaringHand Home Health Care. If you have any questions about the services we provide, please call me directly. We'll set up a consultation or we'll set up a home visit. The number is 208-342-3013.